Hello, it's Dr. Rhonda Johnson. Today is Monday, January 8th, 2024, and today I am talking about glaucoma. Why? Because glaucoma is one of the leading causes of irreversible blindness. The World Health Organization says that 80 million people worldwide have glaucoma, and 4.5 million people worldwide are blind due to glaucoma. Here in the United States, more than 3 million people have glaucoma, and glaucoma is 6 to 8 times more common in African Americans than Caucasians. So most people who have glaucoma don't even know they have it. And 6 years from now, in the year 2030, the National Eye Institute projects that the number of people with glaucoma will increase by 58%, folks. So what is glaucoma anyway? In simplistic terms, it's caused by too much fluid building up. That extra fluid causes pressure in your eye, damaging the optic nerve, the nerve that goes from the eye to the brain, and plays a major role in eyesight. Now, there are two types of glaucoma. One's called open-angle glaucoma, which is the most common type, and the other's called closed-angle glaucoma. And I'm not going to go into that. So what about symptoms? Can you tell you have glaucoma? Well, folks, many people don't have symptoms, so you can't rely on that. What are some symptoms? Again, it could be nothing, or it could be blurred vision, seeing halos or rainbows, having headaches that can go from mild to severe, and eye pain and eye redness. So the bottom line, if you have any problems with your eyes, folks, get checked by an eye specialist as soon as possible. So who is at risk for glaucoma? Again, just because you're at risk doesn't mean you're going to get the disease. But here are some known risk factors. Advancing age, being over the age of 40, having family members with a history of glaucoma can place you at increased risk. If you're African American, Hispanic, or Asian, you have a higher risk. If you have been told you have high pressure in your eyes, if you're farsighted or nearsighted, if you've had an eye injury, if you've been on long-term steroids, if you have chronic conditions such as diabetes, high blood pressure, poor blood circulation, or health conditions affecting the whole body. So how do you diagnose glaucoma, folks? You got to have an eye exam, period. You must see a specialist who's trained to diagnose glaucoma. People ask, can an optometrist test for glaucoma? And the answer is yes. Optometrists can do screening tests, and if they're abnormal, they'll refer you to an eye physician. That's an ophthalmologist for additional diagnostic testing and or treatment. So speaking of treatment, can it be treated? Yes, your doctor can recommend either medication, eye drops. Sometimes people with glaucoma need surgical intervention. The point is, if you have glaucoma, please follow the recommendations of your eye doctor. Keep your eye appointments and manage any chronic conditions you have. So what are my key takeaway points here? Glaucoma is one of the leading causes of blindness. Many people have it and don't know it. You have to get your eyes checked regularly, at least once a year, folks. And if you're African American, you are at higher risk for glaucoma for reasons that aren't really known. And lastly, glaucoma can be treated. You do not have to go blind from glaucoma. That's my message today. I hope it helps, and I'll include a website for more information. Take care, folks.